This month, in PRS, we want to take a closer look at two very important breast articles. Joining me today is our breast section editor, Dr. Maurice Nahabedian.
Thank you for having me, Rod.
It's great to have you with us, Mo. The first manuscript I'd like to discuss is the final installment of a two-part study on a paradigm shift in breast reconstructive surgery in the United States. The authors investigated almost 200,000 mastectomy patients, classified them as either unilateral, in which a patient with cancer in one breast had only one breast removed, contralateral prophylactic mastectomies, in which the patient had the cancerous and the healthy breast removed simultaneously. And bilateral prophylactic mastectomies were performed in women that had a high cancer risk in both breasts. These were removed as an act of prevention. So Mo, what are these authors looking for among these different types of mastectomy?
Well, they really wanted to look at three different trends. The first was what the mastectomy patterns were. The second was to evaluate the socio-demographic factors and hospital characteristics. And the third was to analyze reconstruction rates and methods used for the different types of mastectomy.
What was the paradigm shift that they described, and what does this shift really mean to us as plastic surgeons?
Well, what they found was that the incidence of unilateral mastectomy is now 87%. The incidence of contralateral prophylactic mastectomy is now 12%, and the incidence of bilateral prophylactic mastectomy is 1%. What's interesting about this is when you look at the rates, because the rate of unilateral mastectomy is decreasing by about 2% per year. However, the rate of contralateral prophylactic mastectomy is increasing at the rate of 15% per year, and the rate of bilateral prophylactic mastectomy is increasing at the rate of 12% per year. So what does this all mean? It means that the number of mastectomies is increasing, the number of bilateral mastectomies is increasing, and the number of patients having implant reconstruction is increasing.
The second March article talks about changing trends in breast reconstruction from a patient satisfaction perspective. In this study, the authors surveyed over 120 breast reconstructive patients to determine if the type of breast implant used had an effect on their patient satisfaction and the results. The authors compared experiences and satisfaction after reconstruction with two of the most commonly used silicone gel prosthesis, round versus shaped cohesive gel implant. We know from previous studies that shaped form-stable cohesive implants and round non-form stable implants have similar complication profiles. So Mo, what did we learn from here about the patient experience with these two types of silicone implants?
Well, Rod, there were really two assumptions being tested in this study. The first was that shaped devices are firmer and have a more natural look. The second is that round silicone devices are softer and have a more natural feel. The authors found that shaped and round implant recipients scored similarly on all 9 breast subscales with no significant difference. The implications of this study is there are no differences in patient-reported outcomes based on the use of shaped or round silicone gel devices for breast reconstruction.
What do you hope to see coming out in the breast reconstructive literature in the years to come?
In relation to this project, I'd like to see more studies coming out with different types of gel implants, perhaps more softer gel implants. I'd also like to see a study looking at surgeons' perspectives, because I think that sometimes those can be different than the patient perspective. Sometimes surgeons will look at things a little differently, more analytically than a patient will, and we might be able to discern more of the differences between the shaped and the round devices.
Well, I think that's certainly right on target. We have a lot of work to do and a lot more to look forward to in this complex area that's ever-changing, as is the area of breast cancer therapy. I'm sure our discussion has given you plenty to think about in regards to how we approach breast reconstruction today and what may be coming in the future. So please stay tuned and continue to read PRS to see what the future holds for breast reconstructive surgery and, of course, all of plastic and reconstructive surgery throughout 2013.